don't know if you can tell, but I've just had dental work done on this side of my face, so I can barely speak properly. But I had a few things to share with you, so here goes. And please forgive the fact that half of the side of my face seems paralysed. What I wanted to share is that I am the most nervous of patients, and if you're a nervous patient, make sure you have a dentist that is a specialist with nervous patients. I've had dentists who will try and be kind and try and be gentle, but that's just not their manner. So if you don't do well with dentists or with treatment, and I say this as someone who, if they say something like root canal work, I say sedation please, then you do need a dentist like I have now, thank goodness, who is really, really gentle and almost soporific in her treatment of me. So I'm really thankful that I have her, and it's worth making the change. And definitely ask receptionists because they know what they're talking about. I spoke to my receptionist and she recommended that I go with who I now have, and I absolutely have no regrets. Now, the second thing I wanted to say was, here are my headphones. Now, why on earth am I taking headphones to a dentist? Because I had to have a very deep filling, lots of decay. I'll talk about that in a minute. And there is no way I'm sitting in that dentist chair with the hammering and the drilling and my eyes open looking at the dentist. It's just not happening. So I have my noise cancelling headphones on. You can still hear things going on, but what I do love is I can't hear the dentist and the dental assistant speaking to one another. So they could be saying, not unkind things, no, they'd never say that, but they could be saying things that would make me break out in a cold sweat. But I can't hear it, so they can say what they like. But it's great having noise cancelling headphones. I personally choose to listen to a Radio 4 Agatha Christie drama. That floats my boat. You might want to listen to music, but either way, if you're having work, if you're an anxious dental patient, then definitely take your noise cancelling headphones in and play something of your choice on them. And I have recommended the same technique for people having hip surgery, because you're awake for that now, can you believe it? And they've said it works in the same way it does for me. So definitely noise cancelling headphones when you go to see a dentist if you're a nervous patient like me. And finally, as I've said, I've had work done on my tooth. Over the next few weeks, I will know whether it's going to cause the sort of pain that will mean I need root canal treatment. Thankfully, my dentist said I did really well today, and if I do need root canal work, she thinks I won't need to have it under sedation because I was able to cope today. But honestly, between me and you, it's just not worth it. We are talking decades of me now using sugar as my way to get through life, celebrate the highs and get through the lows. Sugar is my drug of choice, and enough is enough now. I want to have my teeth if I'm going to live into old age. And I guess I'm realizing that everything comes with consequences, that there is a price to pay for what we do to ourselves. And you can see the price that I'm beginning to have to pay in terms of my teeth. I don't want to have to pay it in terms of other things that I could get wrong with my body because of sugar consumption. So I am having to change what I'm putting into my body now. I'm having to reduce with a view to eliminating my sugar content. I am having to find other ways to celebrate the highs and other ways to deal with the lows. So it's just to say, it's not too late. If there is something that you are using that will ultimately harm you, then definitely try to find a way to replace that with something more healthy, because you don't want to be paying a price in the future because of it. So I'll leave those thoughts with you. I hope they helped.